Greetings. Today we had the privilege of having a conversation with Community Voices superstar Tiffany Brown, otherwise known as Tiffany MP, who is a nurse practitioner, yoga teacher, circle keeper, community activist, and health advocate. Tiffany, thank you for sharing your time today. I wanted to ask you, you've been on this journey with the Gem City Market almost from the inception. So I wanted to get your take on what the market means to you.
Yes, yes. Thank you, Brother Amaha, for having me. It's an honor to have this conversation with you. So, yes, I have been involved. I remember being at early meetings actually with you, visioning and paper and markers and such, the way you do, facilitating the conversations about what this could look and feel like. And so, the market means to me, it is owning. It is showing up in a way that helps us self determine who we are and how we want our community to look and feel and how we want to move around in the community, the kinds of things that we want to see, the places that we want to be, where we want to connect in community. So it's beautiful to see it come to life, and congrats and thank you for being a part of that journey.
Yeah, give thanks. So the market came out of a need due to the underdevelopment in the area. What did you sense and feel, or what did you witness as people started to come together to build the market?
For me, it was just a sense of, yes, it's time, where we were seeing things closing, leaving, and like darkening, if you will, especially when we think about the main streets that run from downtown to West Dayton, Salem Avenue, North Main Street. I just remember growing up in Dayton and just seeing restaurants and shopping malls and green space and my friends and I being able to hang out at the mall and go to movies, and how we didn't have that. And so this was an opportunity for us to sort of reclaim and reimagine what we could do to recreate that for ourselves, our families, and our children. Because my daughter really didn't have that same experience growing up in West Dayton. We had to go to Huber Heights and Beaver Creek. She had to meet her friends out there versus, right in West Dayton where I had the ability to. So it was a way for us to reclaim, reimagine, and recreate. So it was exciting.
Yeah, that's a good point. That growing up, Salem Mall was a spot in different places, but it's a generation now that they cannot meet really inside of Dayton, right? That they have to go outside to surrounding areas, Harrison Township or Beaver Creek or Fairborn or Dayton Mall. So how does this market set us on a pathway towards further development of the community? Like we often say, we are the ones we've been waiting for. Like what did that mean to you as far as like the power inside of communities?
Hmm. Yeah, I think where we have lost so much, as we both have just said and both lived through, I think it's about establishing sort of like that home base, that place that reminds us, okay, we can do this. There's hope for the future that we want to see and that we want to create. So it's about connecting, embracing the opportunity, getting involved, seeing where, we can help grow the things that it was intended to do, which is provide healthy food options, which is provide a place for community gathering with the community room for classes and workshops about healthy living, the teaching kitchen. So, how can we be a part of what's happening, but also see where there are bridges to other things that can extend from or lead to So sort of being like that home base, that place where we can organize and develop what we want to see.
Cool. Good. Thanks. What was your feelings like when the market first opened? What were some of your initial reactions, and what did you witness in the community?
So my initial reaction was, wow, like the community did that. And for it to really be something different that again allows us to anchor in healthy living with the clinic being there as well, a place where people can get their healthcare needs met from moms and babies to families. And I know things are burgeoning and still growing, but it was really just like this moment of wow, a place where people can get jobs, people can come and get the things that they need, people can walk to the grocery store, people can sit, outside, people can again come and do classes there. I've taught yoga classes there. We've done some walking groups. I know there have been plenty of events there. So it was really just amazing to see and to be a part of what's changing and what we want to see more of.
You've been involved, like you said earlier, from early on, right? Especially when it comes to health and wellness. So, what if any is the connection you see between the intentional underdevelopment of the West Side and our health outcomes?
Mm, the intentional underdevelopment. Yeah, it hurts. It hurts to hear that. But I think we have to face what's happening. And so when we talk about, well-being in communities, there are certain things that we know need to be there. So something that I just want to share that helps inform the work that I do is this idea of what is community well-being. And so, one definition is that it's the combination of social, economic, environmental, cultural, and political conditions identified by individuals and their communities as essential for them to flourish and fulfill their potential. And when we look at this as a whole, there are three attributes that play a large role in well being: they are connectedness, livability, and equity. So when we look at that, we look at West Dayton and again, the disinvestment that negatively impacts our ability to be connected to one another. The livability, we don't have the same opportunities for safe places to play. Housing, the stock, oh my gosh, the blighted neighborhoods that we have, the lack of access to culture and the arts. And in terms of equity, all members are treated with fairness and justice with their basic needs met. There's equal opportunity for education, employment, and meeting individual potential. So I think the disinvestment negatively impacts all of those areas, which are all important when we talk about health, those social determinants of health. It's more than about your blood pressure and your blood sugar, your height, your weight. While all those things are important, we know that the social determinants of health play a part in how our bodies are able to respond to challenges, whether that's physical, mental, emotional. We need to really feel like we are in a connected, livable, and equitable community.
Thank you. I appreciate that, especially expanding the definition of health, right? Because oftentimes, we think of health as just, diabetes and blood pressure, right? And not looking at how our life expectancy is determined by our zip code, and that 80% of our health outcomes are place based. So thank you for sharing that. What role could the Health and Wellness Committee, what could that do towards meeting those ends of the community well-being that you mentioned before? Like what is the possibilities for the market, through health and wellness or just in general, to make an impact on those indicators that you mentioned in the community well-being?
It's a good question. So I would say, again, looking at what's available to us and involving the community in the conversations, right? Because it's one thing to create something that has potential, but then it's another thing to activate that, right? And so now we're in a situation where we have places that we can gather. We have a kitchen that we can cook in. We have the community room where we can have classes. We have the clinic where people can come and talk to healthcare providers. And so I think part of it is really looking at, what the need is. And when we look at, like you said, the social determinants of health and what our community is really suffering from in terms of our health outcomes, lifestyle factors have a lot to do with our rates of obesity, diabetes, heart disease, strokes, depression, anxiety, all of those things are impacted by the places that we live, right? And if we look at West Dayton, just not even from a statistical perspective, but just about, again, that darkness sort of that I talked about. What is it that you experience? How do you feel when you're in West Dayton? What are the things that you see? What are the smells? What are the people that you notice? Where are opportunities to experience love, laughter, and joy? And so I think that we know there are some things that we definitely need to be talking about. We need to be talking about how to help people move more. And so I think that the market is in a walkable community. So that looks like some walking groups. That looks like community cleanups, which is something that, again, helps us feel good about where we live. Also, we've got the community room for moving. We also know that you can't out exercise a bad diet. I'm sorry. We tried to, but we know that we need to be focusing on nutrition. And so the Teaching Kitchen is a great opportunity to have community members in there cooking and going through the store and scavenger hunts and coming back and learning about, what to do with garlic, what to do with ginger, how to make a healthy soup, how to make a healthy salad. So those are some things that I think we know we need to do. And then we also should engage the community on how do they see utilizing the spaces, because again, if you build it and they will come, yes, but we need to make sure that those who are building it are invested in what we're building.
Yeah, I couldn't agree more, right? As far as like how to activate the market and how do all the members who are leaders, right? How we utilize it towards meeting our shared future and co-creating our shared future together. So yeah, thank you for that. Anything else that you want to share as far as the relationship between health and the market, or what's your favorite what's your favorite thing you've witnessed since the market's been open? Something that stood out to you.
Mm. There's so many things. I really just think part of it is just being able to see again the vibrancy and, you know, like my daughter's, friends working in there and just, running into friends that I haven't seen in a while, running into my mom in the store because we're intentionally like coming here. There are so many stores that we could go to, but we're coming here because we want to be connected. We want to support. And so I think that's one of the things that stands out to me is just the fact that those of us who are connected are coming, are showing up and want to be a part of the exciting things that are happening, the movement, the mission, the magic.
Oh, I like that. We might have to, that might be our new tagline. Yeah, no, I appreciate that. Like I love being in the market, and I'm always running into people, some I haven't seen in a long time, or just you mentioned connection earlier, being a part of health, right? And part of the goal of the market was to be a third space, right? Where You have a home, your job, and then where are you in community where you can have community. I'm thankful to be able to witness that emerging. Anything else that you wanted to share about health, its connection to place, its connection to the market, how we can self-determine our health outcomes, right, by the structural work that we do in the community, or in anything that you hope that I asked that I didn't ask.
Mm, yes, just that I am inspired by our willingness to, and our ability to really, really heal ourselves. And it starts with that awareness that, again, we are the ones we have been waiting for, and that in this human experience, we're equipped with everything that we need to survive and thrive. And unfortunately, I think that we forget that because of a built environment that, structural racism, things that I know you've talked about and will continue to talk about. But I think we also have to have a self care practice and an awareness that this journey is not without pain, it's not without struggle, it's not without challenges or sacrifices, but that working to overcome them, to reach out to people and places that can help us heal in ways that are meaningful for us. It's not one size fits all. So, those of us who are again connected to this movement, we are unique and special, but we're in a shared experience. And I think that the more that we can connect and communicate, the better we are at living, healthy living at that. And that's the goal. But it's not about perfection, it's about persistence and progress. And we will get there if we just keep going and keep showing up for ourselves and each other.
Well, I must say, not only was that inspiring, but it made me feel better about myself because I got a long way to go on my health journey, and so you kind of just gave me room and space to be human and to continue to strive towards improved health for me and for my family. So I want to thank you very much, Tiffany Brown, for your time this evening, and wish you well.
Thank you so much for having me. I appreciate this time and I wish you well also.
Good, thanks. Peace and hair grease.
Ashe.